Welcome to our channel. Today, we're diving into a rare and intriguing neurological condition known as Fahr syndrome. This disorder is characterized by abnormal calcium deposits in specific areas of the brain, particularly the basal ganglia, which can lead to a variety of symptoms. Let's explore what Fahr syndrome is, its causes, symptoms, and how it's diagnosed and treated. Fahr syndrome, also referred to as idiopathic basal ganglia calcification, is an uncommon condition often recognized in middle-aged adults, though it can sometimes emerge in childhood or adolescence. The exact mechanism behind the abnormal calcium buildup in the brain isn't entirely understood, but it may be linked to genetic factors and metabolic abnormalities. In around half of the cases, this disorder is familial, indicating a hereditary pattern, particularly associated with mutations in the SLC20A2 gene or other genes like PDGFRB and XPR1. Now, let's discuss the symptoms associated with Fahr syndrome. The manifestations can vary widely among individuals and often include movement disorders, cognitive decline, and psychiatric symptoms. Patients may experience dystonia, which is characterized by involuntary muscle contractions, tremors, or even Parkinsonism, a set of symptoms that resemble Parkinson's disease, including rigidity and bradykinesia, or slowness of movement. In addition to motor symptoms, cognitive impairments such as memory loss, difficulty concentrating, and challenges in decision-making can occur, impacting daily life functions. Psychiatric symptoms can also present, including depression, anxiety, and even psychosis in severe cases. Diagnosing Fahr syndrome generally involves a mix of clinical evaluation and imaging studies. Physicians will consider the patient's medical history and symptoms, followed by neuroimaging, typically MRI scans, which can reveal the characteristic calcium deposits in the brain. These deposits are often found in the basal ganglia, thalamus, and other regions of the brain. Genetic testing may be conducted, especially if there's a family history of the condition, to identify any underlying hereditary causes. Currently, there is no cure for Fahr syndrome, and treatment mainly focuses on managing the symptoms. For movement disorders, medications like anticholinergics or dopaminergic medications may be prescribed. In cases where cognitive decline is significant, cognitive rehabilitation strategies are employed to help maintain brain function and improve quality of life. Even psychiatric symptoms may necessitate the intervention of mental health professionals, who can recommend therapies or medications to address underlying issues. Living with Fahr syndrome poses challenges, not only for those directly affected but also for their families. Support networks, rehabilitation programs, and occupational therapy can play a vital role in enhancing everyday functioning and providing emotional support to both patients and caregivers. Research is ongoing, aiming to better understand the mechanisms of Fahr syndrome and to uncover any potential treatments that could modify the disease's course. Genetic studies are crucial, as they might offer insights into the causative factors and lead to discoveries of effective therapies in the future. Awareness and support are essential to improve the quality of life for those affected by this complex condition. In conclusion, Fahr syndrome is a rare yet impactful neurological disorder with a diverse range of symptoms linked to abnormal calcium deposits in the brain. Understanding its causes, symptoms, diagnosis, and treatment options is vital for those affected and for the healthcare professionals who support them. If you or someone you know is experiencing symptoms indicative of Fahr syndrome, it's important to consult a healthcare provider for a thorough evaluation and tailored treatment plan. Thank you for joining us today. If you found this video informative, please like and subscribe for more educational content on rare medical conditions and neurological disorders. Stay curious, and see you in the next video.